Judy Gaman is our guest. She's a healthy living expert, and her website is judygaman.com, GAMAN.com. And I wanted to bring her on the air to discuss what has been discussed, but maybe not necessarily in an acute fashion, or we haven't really zeroed in on how we take care of those who take care of us, healthcare workers. It is becoming increasingly more mainstream, the pandemic fatigue, which all of us, in some way, shape, or form, are experiencing. However, it is real. It is hitting a lot of healthcare workers now, with cases on the rise, particularly those in not only the hot spots, but the rural areas where the resources are very, very limited. So what do we do? What is the problem? How do we solve it? What can we do? Well, we turn to Judy to help us out with that. Judy, welcome to KDKA Radio in Pittsburgh. I appreciate your time.
Oh, so excited to be on with you. And this is such a great topic. I'm glad that we're covering it. You know, as the CEO at Executive Medicine of Texas, and being in a family of all medical people, and we got doctors and nurses in our family, this is something that's really hitting home for us, and that is the fatigue. And we're just seeing so much of it. And you have to think about where we were to begin with. I mean, you're in Pittsburgh, and let me tell you, Pittsburgh, before the pandemic, already had a healthcare shortage. So because you had a shortage of nurses, and it was great. I mean, they were talking about this back in 2018, saying we've got to get more people in these nursing programs, and they just haven't ramped fully up. Then you have the pandemic, and you have people working extremely long hours without extra coverage. It's like being in a relay race and no one to take the baton. They're just running and going and running and going. So for Pittsburgh, it's especially interesting because you already got that shortage. So for your listeners, I heard that you have someone coming on about getting back in the workforce. And for your listeners, if you are thinking of making a change in your job, your career, think about going into nursing, think about going into the medical field, because we now have a shortage, but there are going to be a lot of people that are just so burned out, they're going to change careers. So there's going to be incredible opportunity for people who want to get into the medical field.
So Judy Gaman is with us. She hosts a syndicated radio show. She's an author, she's a speaker, a wellness expert, but her focus is primarily on the healthcare industry, the healthcare workers. You mentioned the nursing shortage in our area 2 years ago. How do we hold up and grade out relative to some of the other cities that you would probably consider our peers?
Well, I think you definitely have ramped up a bit, but we are seeing across the nation these shortages. And so, yep, that's what's happening in Pittsburgh, but I got to tell you, we have that happening in Dallas. It's happening all over. There are some areas, I would even say here in Texas, we're doing a little bit better, but all across the country, we're seeing these shortages. Pittsburgh, yeah, you guys made some national news with this shortage, and it takes time. You know, once you say we've got a shortage and we've got to, get people into these programs, it takes time to educate them, get them out. And back in 2018, when it was really kind of coming on national news, even if you right then, that moment, started enrolling people and putting them through the process, they would just now start to be getting, your 2-year degrees out. And now there's so much demand for BSNs, which is a 4-year degree. So when we look at the fatigue that these individuals are having, particularly nurses, it's just twofold, and we've got to give some relief.
How do we do that?
Well, we definitely have to find unique ways to pull them out, to be able to maybe allow state reciprocity. So right now you get your license and it's for whatever state you're in. But if we have some reciprocity, we can take some nursing staff from other states, other areas where we're not seeing hot spots, and they can pass the baton and say, gosh, we need a rest. Bring in some people to come in and give them a break. And if we can all do that, and even if we just pick like surrounding states, we say, okay, we have reciprocity with 3 states around us, and we do that all the way across the United States. We're going to help relieve that pressure, that tension. We're going to keep people from quitting, because if we don't give some relief, we're going to see burnout. And what happens when we see burnout? We see chronic disease, we see death, we see complete change in careers. We've got to keep people so, one, they still want to be in their career, but also they're not having chronic disease because of this intense amount of stress.
We're chatting with Judy Gaman. She's a healthy living expert. She hosts a nationally syndicated radio show, judygaman.com. Her focus is primarily on healthcare workers, and we're particularly focusing in on the pandemic that's leading to healthcare worker burnout. Can you share, because the burnout is so prevalent in this industry, maybe what the attrition numbers are? I don't want to put you on the spot there, Judy, but it sounds like it's probably more so than your typical high-stress industry that requires so much. I didn't know if you had that quantified.
I don't have the exact number, but I can tell you that we started in the hundreds of thousands, but now we're seeing it just completely across the medical field. Everyone's feeling burnout. So we're talking about millions of people are feeling this. And when we want to help relieve some of that stress, we want to help bring that burnout to an end, there has to be a relief in sight. I think we will see that as some of this kind of pans out and we don't have as many hot spots. When we get a vaccine, that will help. But you have to remember, everyone is already stressed because of the pandemic and because of the fears. So normal people that aren't in these positions are already feeling stressed. So you take that and then you multiply it times 10. People going to work as healthcare workers not only are afraid for their lives, worse, they're afraid that they will bring something home to their families. And that's a bigger fear. We all say we can take care of ourselves, but when we think we could have been the cause of grandma or our spouse or someone in our family getting sick, that brings it to a whole nother level. And I've heard it said that there's a new respect among the healthcare workers for police and firemen and the spouses, because when police and firemen go out, they're walking into danger, and they don't know if they're going to be coming back that day. And really, it became that. The front lines in medicine became that. And there was kind of this change, this shift. Wow, this is like a fireman walking into a fire. And even within the households, there was a little bit of PTSD with the family. The spouse of that doctor, the spouse of that nurse, the spouse of the ER technician, the person that rides the ambulance, all of these jobs, it wasn't just the stress within the employee, but also the family members.
Judy Gaman, our guest, a healthy living expert, nationally syndicated radio host, author, and speaker, as we discuss the pandemic leading to healthcare worker burnout. You touched on some of the causes of this fatigue and the burnout. Is it largely the fact that they are, A, worried about contracting the virus themselves or being carriers into their house when they go home? What are some of the other causes of this and the real root problems that we need to address?
Well, we need to address the unknown, especially in some of our hospitals. The unknown of, am I going to have the protective equipment that I need when I get there? Are there going to be processes in place? Are the hospital administrators looking out for us on the unit level to make sure we have everything we need?
Let me interrupt you, Judy. Are we still falling short in that respect? Because as I was led to believe, PPE, those shortages that we were experiencing in March and April, have we not industry-wide stabilized that and gotten our professionals the resources they need, or is that still lacking?
Well, here's the thing. It's available. So I just had a conversation with someone who works in the hospital this week, and they got their PPE equipment, and it had been ordered, and who knows where it came from. But she was explaining to me that it was not supposed to be it was supposed to be waterproof. The water was not supposed to be able to permeate the material. And they soon thought, this is way too thin. There's something wrong with it. So
they're making substandard stuff, if I hear you right.
Absolutely. That's the problem. So the hospital administration and whoever's buying the equipment needs to be doing some QA. some quality assurance on this stuff, because it's coming in, and because there was such a shortage, people were just grabbing what they could get. We're getting a lot of stuff. We're getting a lot of stuff from overseas, and it's subpar.
Judy Gaman with us, healthy living expert, healthcare worker. Workers are her primary focus here, radio host, author, speaker. So that's obviously a concern that I wasn't anticipating at the outset of this interview. What can we do as ordinary citizens, Judy, to maybe be more of a solution as opposed to a problem, heaven forbid, if we get sick or have loved ones who are sick? How can we lessen the burden and not add on to the burnout and the burden that healthcare workers are carrying for us?
Well, there's a few things. You don't take your whole family to the doctor's office. If somebody has an appointment, you let them go in. They don't need crowds of people. We've got to be smart about this. We need to only be sending in who needs to go into those appointments. And remember that everyone's human in the medical field. So please be kind. Please treat them with respect. I know that my husband actually has two practices, and then he also has a COVID clinic out of one of the sites. And whenever someone meets that criteria, they have to automatically go to the COVID clinic. And so someone came in and they had a fever, and they said, well, you have to go through the COVID clinic. We have to assume everybody has it before we can allow you in a wellness space. And that particular patient got furious and said, I don't have COVID, and threw a fit. And all that does when we act like that is we take an already stressful situation and we make it worse on ourselves, and we make it worse on everyone else around us. So be kind and be smart. I mean, just being kind and just being smart is going to help so much.
Simple things that really go a long way, huh, Judy?
Absolutely. Absolutely.
That's a great point. Judy Gaman, a healthy living expert. Judy, what else should our general listener know outside of what you just said? Kindness, compassion, all the things that nurses and healthcare workers are ingrained to do for us. What else can we do? What else should we know?
We should know that we cannot make it political. The mask wearing, the testing, all of these things. These are humanitarian issues. They are not political issues. To wear a mask or not to wear a mask, people walking around saying, well, I don't want to wear a mask, I don't care if I get it. That's not the point. The point of wearing the mask is to keep other people from getting it. So when you do wear that mask, you're saying, I'm looking out for you, my brother, my sister, my friend. Don't be arrogant. Put on your mask. We all have to participate at a level that is above where we argue and we do all these ridiculous things. We have to get to a point where we're going to say, we're going to protect the weakest among us. And you don't know, just because someone's not 80 years old, you don't know that they don't have lupus, they don't have, they're not post-Lyme, they don't have some kind of autoimmune disease that's going to make them so susceptible. So just assume that everyone is susceptible, and then you can protect the weakest links.
Judy, thank you so much for your expertise. More importantly, your time. It's at a premium at this moment in our nation's history, and we appreciate you jumping on the Voice of Pittsburgh here to lend all of that, and I think we're better for it. Thank you so much.
Always a pleasure.
That's Judy Gaman, healthy living expert. Her website, judygaman.com, Gaman, nationally syndicated radio host, author, speaker, focusing on the healthcare industry, its people in particular.